Good afternoon. I just received this in the mail. And it looks like it's my Elida. This is the medication that I take together with Lubron, which is a shot that I take once every 3 months to suppress the testosterone, or it's part of the hormone therapy. So this will be the third bottle since I started with this. Okay, so but before, when I was first diagnosed, they told me to start immediately on this one, the bicalutamide. Then after about 10 days of this, they told me to switch to Elida together with the Lupron shot. So it's been about 2 more days, 3 months since I started with the hormone therapy. And there were some side effects. The bad one is the sleepless nights. Sleepless night. I just can't go to sleep. So my PCP told me to try this one, melatonin. Well, it didn't work. So let's put this here. Then she said to try the medical marijuana. It comes in a gummy. It's supposed to calm me down and see if I can go to sleep with that. That was good. It was able to calm me down and settle my nerves and kind of stop my mind from wandering. Then I was able to sleep. But it has its own side effect. What happens was that medical marijuana triggered my cluster headache. And when that's an old friend, it's a chronic thing. And when I have cluster headache, it is very painful, but it usually lasts for about 3 weeks. So that was the end of the marijuana thing. And then the doctor told me to try this one, the magnesium glycinate. Well, this was okay too, but it wasn't really helping me a lot anyway. So this one, disregard that one. And then they told me to take this one. They prescribed this one. It's another magnesium one, but it's a threonate. And I started this about 3 days ago. And this one works. This one works. They reckon that this one goes straight into your brain and help controls your sleeplessness. And I must say that it worked all right. But then, what is that? Mac Freonate. So that's the one I'm going to continue taking. And then my PCP told me if this one, because sometimes they stop working. I don't know why. And then they say if this one stop working, and then I can try this one. It's called Trisadone. I don't know if you can say it, Trisadone. So I have it here with me, but you can only take half of it, half of the tablet. It is about how many milligrams? Anyway, I'm only allowed to take, in other words, I have to divide it into two and then take one half. Then my daughter, who is also a medical doctor, looked at this and then she told me not to take it until she does some research on it. So sometime tonight, she's gonna be here. She's gonna bring her echo machine and find out my heart conditions, because she said that it can affect your heart. So I'm waiting for her tonight to bring her echo machine here home, and then we'll find out whether my heart can handle this. Apparently she talked to my PCP and they both agreed to do this. Okay? One other things about this medication, they're not cheap, especially the Elita. This one. And I'm pretty lucky here in the States, 80% of all my medication is covered by Medicare. So, but they told me, and then I paid 20% of it. And my 20% came out to $2,500. Medicare covered the other 80%, and then this one comes to 20% comes to $2,500. So you can imagine the total cost of this thing. Well, anyway, I applied for a grant, and I was able to get enough money to cover this. So now I don't have to pay anything for this one. So you really got to know how to access the resources to help you with this thing. All these other medication also, except this one, out of your own pocket, because it's on the counter. The other ones, you pay 20% of them. So these are my cancer medication. I thought I'd share this with you. Okay. On top of that, I have 5 other medications which are in this box, my tray here, that will treat my high blood pressure, my heart problems, and my diabetic. 5 medications to do that, and I take those daily. Okay. Well, I thought I'd share that boring information for you. It's a very cold day today, so I'm not going anywhere. I would just stay home and make sure that I take all my medication and drink my coffee. This is my, if you can remember, this is my wife's surprise. Faith makes everything possible. Okay, thank you for your time. I'll see you next time. Thank you. Ja, tot va. Alles gemacht.